Hello guys, how are you and welcome to my YouTube channel. I am really glad and excited to have you on board. I'm doing a series on miscarriages, and today we talk about the kind of miscarriage which is impossible to salvage despite the fetus being alive, what we refer to as an inevitable abortion. Karibu sana. So guys, how will you know you have an inevitable abortion? Normally what happens is you are a pregnant woman. Previously you've had bleeding coming off your vagina that's not been a lot, either painless or associated with some little abdominal pain. Now what happens is that all of a sudden there's increased vaginal bleeding, larger and larger volumes of blood coming out of your vagina. And then there's that increase in pain that is crampy on and off and just doesn't seem to get better. Many a times when such symptoms kick in, then it's highly unlikely for the pregnancy to be salvaged. And at the end of it all, it will come out either spontaneously or through the intervention of a health practitioner. Besides the bleeding and the pain, some patients also have sudden release of amniotic fluid coming off your womb out through your vagina. And normally this comes in as you get this watery discharge that is continuously flowing down up to your legs. It just doesn't stain your pants, but it just flows down. And in such cases, especially in the first trimester and between 12 and 22 weeks, it's very impossible to salvage this pregnancy, and at the end of it all, it will come out. So we make a diagnosis of what we refer to as an inevitable abortion. In case of such symptoms, you'll come to hospital. There are key investigations which we will do. Basic investigations like a full hemogram to see if your blood count is okay, if you have an infection, and then we'll now do what we refer to as a speculum exam, and the findings of these will help us to further confirm the presence of an inevitable abortion. In a speculum exam, a speculum is inserted through your vagina and opened to allow us look at your cervix, and in case of an inevitable abortion, your cervix is wide open, and when you put your fingers inside, you can actually feel the products of conception. We also send you for an ultrasound that will help us to further confirm the presence of an inevitable abortion. So once we confirm, we have to sort you out. If your pregnancy is 12 weeks and below, we will do what we refer to as manual vacuum aspiration, where we suction the contents out manually out of your womb using what we refer to as an MVA kit. There are people who decline to having an MVA, so instead we use the medical approach. There's a drug we give you, misoprostol, at a different dosages depending on your gestation. If you're 13 weeks and above, it becomes a little bit difficult to suction the contents out, and so we do the medical management where we give you a drug we refer to as misoprostol, different dosage again depending on your gestation. And there are people who've already started cramping and they're having contractions, so we just augment the contractions to allow expulsion of the fetal contents using a drug we refer to as oxytocin. That's it from me on an inevitable abortion. If you have any questions, comments, or clarifications, you're free to do so. Next, we'll be talking about, please subscribe to know more. Karibuni sana.